Good afternoon. Good afternoon. Jeffery Jones, Universal Family Connection. We're here every first Wednesday to talk about your health, HIV, and the things that we do concerning HIV at Universal Family Connection. I'm here along with my co-worker, Mary and Lade. They'll introduce themselves. Today we're going to talk about World AIDS Day. Okay? So stay tuned.
Mary Turpin, I'm the case manager for the risk department at Universal Family Connections. Happy to be here.
Lade Ademosu, health educator, Universal Family Connection.
So we hope that you will stay tuned for the whole 30 minutes and call in if you want to. Are we calling in today? Maybe not. Well, you can watch and learn about World HIV Day. World HIV Day. No, World AIDS Day. My apology. I'm so used to saying AIDS and HIV, but it's World AIDS Day. What is World AIDS Day? It's a day that the World Health Organizations and other partners who serve the HIV positive community, we come together and to commemorate the lives of those who have lost. We've lost over the last 40 years. We come in here to talk about what do we do to educate ourselves for the time coming up, and to point at some of the things that have been realized over the last 40 years. So Mary and Lade and myself will be talking about that, along with at HIV World AIDS Day that we had at our agency, Universal Family Connection. It was this Sunday, December 1st. It's every year the same day, December 1st. And so we chose to have some speakers come in and talk about HIV and AIDS. We gave away some awards to some of our long-term survivors. And we also unveiled a vehicle that was purchased with assistance from the Illinois Black Caucus, and so we presented them with an award as well. So we're just going to talk about that today and a little bit about HIV. One of the things that we want people to know is what HIV is, what it stands for. We want to educate you on it. We want to talk about prevention. We want to talk about abstinence and those things around HIV, because one of the main ways that we can stop the spread of HIV is to be educated about it. So Lade is going to give us some facts about HIV.
As we've always discussed, HIV is human immunodeficiency virus, which anyone can catch it, the infection if you are negligent or if you are not very careful. Why do I say that? Because you can get it through different sources like blood contact, semen contact, through mother-to-child breast milk, semen. Did I say that?
Yes.
Some people, they actually got it from blood transfusion unknowingly. Ryan White was an example where they have his legacy lives on today due to that, because I guess this blood wasn't screened back then, and he got his transfusion. But for other reasons, it could be through sexual intercourse unprotected. And if one person is infected and the other person mates with that person, of course, and they had open sex, it's sometimes automatic. Sometimes it can be prevented if that person, there are medication now, they call it PEP, that if you have intercourse with somebody who is exposed, you can go to the emergency and get PEP, pre-exposure prophylaxis.
That's
post-exposure. I'm sorry.
Let me ask though, Lade, is there a cure for HIV?
They are working on it now, but the medication that they are doing so many researches, and a lot of people are undetected now, which
Undetected.
means you equals you. Untransmittable means undetectable means the person cannot transmit it to another person, which is a great thing because of the medication. But they are still working on complete, cure. There's no cure for it. There's no cure, but you can go to a level that you cannot infect anyone else if that person is taking their med and taking care of themselves properly.
And that's really important. And they have a campaign we talk about you equals you. And that really means undetectable, means untransmittable. So if you're having your partner is not HIV positive and you are HIV positive, as long as you're undetectable, you're seeing your physician as often as you need to, if you're taking your medications, you are virtually undetectable. That doesn't mean you don't have HIV.
Yeah.
That just means that you're undetectable, which means that the test has to have more copies of HIV in your system to detect it. But it cannot be transmitted to your partners through sexual intercourse. Now, if we do blood to blood where you're using needles with the person, even if you're undetectable, you can still pass it on. So we need to let you know that.
Yes.
So that's through sex. Mary, what is PrEP? What is that all about? Tell us that.
Well, it's a medication that if you think you're getting ready to have sex with someone, you don't know their status. PrEP is a medication that you would take that will protect you from contacting HIV.
Okay, now, how long does PrEP need to be in your system before it's effective?
7 days.
7 days? I thought it was a little bit more
20,
than that.
yeah, 27.
20-something
28
days.
days.
But suffice it to say, that person needs to at least have a minimum of a week, but you have to go to see your physician first. He has to give you a test to make sure that you're not already HIV positive.
Yeah.
And then they'll start to administering the PrEP. And PrEP stands for prophylactics.
Yeah, pre-exposure
Right,
prophylaxis.
pre-exposure prophylactics. And so that just means something that you do in advance of HIV. Do you have PrEP for women as well?
Oh, yes. They have
PrEP.
PrEP pills for women, yeah.
Okay, because they seem to always focus more
On men,
on
on
men,
gay men especially.
especially gay men.
That's
And
not
PrEP,
the situation anymore.
Right.
PrEP is open to every gender and sex right now. So
something they said at our World AIDS Day about PrEP. What's the age that you can take PrEP at?
Oh,
Go ahead.
At 18, start taking.
No.
actually, you can start as early as 12 years old. It depends on the state. For
Right, that's what I wanted
For
to-
Illinois,
for
it's
Illinois.
12 years old because a 12-year-old can consent to medical treatment as of that age. So, but some states are 14 years old.
Right.
Yeah.
Some states it's a little bit
Yeah.
older. And so we want, why is that important? Because you need to know there's legal questions behind who can take PrEP, how do they need a parental consent to take PrEP? And here in the state of Illinois, fortunately, I guess, or maybe unfortunately, a child, 12 years old, can consent to the HIV test and things like that without their parents' knowledge or consent.
Is that a good thing or bad thing?
Well, and it's up for debate. Some people think it's good because the fact that the person that they're trying to hide it from might very well be the parent in terms of somebody molesting a child and the child trying to get the help that they need.
Yeah.
So it's not always black and white, why the reason behind it, but I would hope that my child would come to me about something as important as
That
this.
is so true. I struggle with that too, that a 12-year-old can go ahead and do, but on the other hand, like you said, if they are suffering from molestation and he or she can't even share it,
Right.
because we've had cases of rape and all
Exactly,
that,
exactly.
which is sad. So it's a good thing and
Right.
a bad thing. It's catch-21.
And you know, as we're talking about this, HIV doesn't care how you are contracted. So if you through rape or incest or anything like that, it just doesn't matter to the virus. And so it's so important that we think about those things when we're making legislation and doing advocacy work, that it just doesn't care. And so we have to be careful about the laws that we put in place and policies that we put in place to protect people who may or may not be HIV positive. And we said HIV was human immunodeficiency virus, right?
Deficiency virus.
And what does AIDS stands for? Acquired immune deficiency syndrome. Syndrome is S. And that's a collection of different, what they call, it's not diseases, but symptoms that you might get from HIV that turns into AIDS. Why is that important? Because in this new administration with that's going to be led by our President-elect Donald Trump, the Robert F. Kennedy Jr. says that AIDS or HIV doesn't lead to AIDS. But he needs to know a quick lesson on AIDS as it pertains to people who have been infected with HIV, that it does lead to AIDS. All of the research points to HIV leading to AIDS. And so it's important that you know that and that you take your medications on time, every time, so that it will not lead to AIDS.
And that's why a lot of people are still living a good life, even though they are HIV infected. By taking their meds and, following the ritual health guidance, and they are living a fruitful life. We actually had some awards, like Jeffery said, on Sunday. I was so proud of all of them. It's amazing because if you listen to each person's story, it's very touching, and one of them was very emotional. I'm guessing she flashed back to when it happened to her.
Yes.
Like, is this for real?
Right.
She was emotional. And but the event, everybody cheered her up, and she calmed down, but she's doing it, and she's like, I'm alive.
And she's thriving. And you know what? That brings up a point here. So on Fridays, you say this to yourself, every Friday at Universal Family Connection, starting at 10 o'clock, but most of our clients get there at 8:50 sometimes to make coffee.
Yeah.
And but we have a support group, psychosocial support. We talk about anything and everything related to HIV, dating after HIV, sex after HIV, seniors and HIV. So we covered the whole gamut there on Friday. That's at our location from, like I said, 9 o'clock until about 1:30, 2 o'clock sometimes. We sit there. We always have a nutritious and delicious lunch available. And we're going to soon have a transportation where we'll pay for those the money that you need to get there. So if you're interested in sitting down and having somebody to talk to, walk with on this journey after 25 years, this young lady that Lade was talking about, she said she cried, but it's been the help of her support group. Because sometimes, Mary, your family doesn't support you. And you were telling us a story about how somebody in your family was diagnosed with HIV.
Yes.
And they denied them, like, yeah, we don't want you here. We don't want you to share our plates and spoons. And so that can be degrading. It can be dehumanizing. But our support group lets you know that there is life after HIV. And there's a really good life after HIV. So it's no longer a death sentence. They call it a chronic manageable illness now. So all you have to do is come in and get tested. Yes. Find out. It's better to know than not to know.
Yes.
I'll say it again. It's better to know than not to know. A lot of people think that knowing will put them at risk for saying you knew that you had sex and knew that you were positive and had sex with someone. But that's no longer the case here in Illinois. You won't be brought up on charges. You don't have to always tell someone that you're HIV positive.
Let me interrupt you. You say you won't be brought up on charges if you don't disclose your status?
No.
Is that a good thing?
It is a good thing. For me, it's a good thing because you are responsible for your own health. I'm not responsible for it. Ask the right questions and use your own brain. You can't have sex with everybody. You can't shoot needles with everybody. You can't visit everybody's tattoo parlor. You cannot do those things and then expect other people to protect you from the virus. Yeah. Grown people, and I know it's not always rational thinking adults that are having sex. It can be young teenagers. It can be 12-year-olds, which you're finding out that are having sex. And sometimes with older men that can manipulate them. Yeah, but they don't always have to tell about their status. What do you think?
A 12-year-old, that's, well, like we know, we're in a different world now, and they are sexual active, but going to their, telling someone about their status, well, yeah, I think it's a good thing to know, because you can't prefer them to somebody, and you can't sympathize with them and put them on the right track, give them a whole lot of information about what's going on with them.
Mm-hmm. So, what do you think?
Yeah,
Is it good or bad that the laws have changed in terms of reporting HIV?
I think it's both ways. In my opinion, it is good in the sense that if they disclose it or they trust somebody to share it with, and then they can get the help. And that's what we are advocating for. That's what we preach all the time. It is a good thing. But it's also a good thing that they can take a step and get help, get diagnosed without parental consent. But
yes. It's one of those things.
Yeah, we had a 14-year-old to come to the office, and we tested him because he was afraid that, he's been living on the L, doing drugs, and he thought he may be HIV positive. But we tested him, and it was confidential.
He wasn't sexually active.
He wasn't
positive. And that's a good thing.
Yeah.
And it's important that you know your status. That's why we do this every Monday. If we talk about the same thing, it wouldn't matter to me because it's important to us that you know your status. We are with our clients several times a week in addition to the every Friday where we sit down, and these people have become like family to us. And so we understand what they're going through in the situations that being positive puts you in. And we also know that even today in 2024, we are dealing with stigma.
Exactly.
And so everybody, even though they might want to tell you that they're positive, don't have the courage to talk about it. They're afraid that you're going to ostracize them, that you no longer want to be with them, and rightfully so. It's your right to not want to be with them. But that puts them in a position of, well, I have to hide my status. And so we come here to do these programs to let people know that you can get a test, and Mary talked about it, confidentiality. We don't share your information with anybody. If your mother calls up and says, my son came there for a test, we can't tell her.
No.
If your boyfriend or your girlfriend, your partner shows up and asks about the test, we have no right to share that, and we don't.
No, we don't.
Because that's your business, whether you're positive or negative.
Mm-hmm.
So if you're interested in testing and knowing your status, you can call us at 773-881-1711. Again, our number is 773-881-1711. And we are located in the Beverly community at 1350 West 103rd Street. And so we would love to have you. If you are HIV positive and you need an awesome support group, we're there for you every Friday from 9 until 2 o'clock and even longer. So we have about 5 minutes left really quickly. Go ahead.
Tell them who to ask for when they come to the agency. Ask for, Mary Turpin, Jeffery Jones, Lade, Ademosu.
Or Juliet Jones. Right.
And also, keep in mind, if you are HIV positive and you are struggling with a lot of things, the group is very, very good. It's a good thing to come and participate. I had a client that just called a couple of days ago, so I'm going to call her tomorrow to follow up. She obviously needs a lot of help, and that's what we are talking about. So I encouraged her. I gave her the address, and I'm going to follow up with her tomorrow to remind her that she said she will be coming to the group. And that's what anyone struggling, if you're HIV positive and you don't have anyone to talk to, you are not in any program, you are free to call us and you can join the group. It's very easy. We take everyone.
And it's very helpful. Another thing, Universal Family Connection is a all-purpose, one-stop social service. So we have a mental health counselors, we have substance abuse counselors, we have perpetrator abuse intervention program, we have a domestic violence program, child welfare program, we have housing programs, we have job programs, family violence, victim support groups, everything that you might want at our location. Substance abuse. So please come in and see what we have available for you. We accept families and individuals. There's no cost for the services. So please come in and learn all about us. We're there from 9 to 5, Monday through Friday. And even if you need to see us on Saturday, call in during the week, and we can make arrangements even to be seen on a Saturday. So please, if you're struggling with anything, not just the HIV, come by and visit us.
And now that we have mobile health van, our service will expand greatly.
Yes, we didn't even get to talk about it.
We were doing it with our regular van, but now this is actually medical mobile van.
And it's a state-of-the-art vehicle, so if you have any events, HIV events,
and you want us to
want us to come out, we can come. Even if they're not HIV events. If they're events at all, we can come out. We're going to be doing vaccinations. We're going to do education. We're going to be doing hepatitis, monkeypox. So please call us out, and we'll be glad to come and assist in whatever activity you're having. Mary, you got closing thoughts?
Like you said, we're located at 1350 West 103rd Street. And you can ask for the risk education, someone in the risk education department. And like you said, it's strictly confidential. Not like we're going to go out and broadcast it. So that will be there.
Once again, we are from Universal Family Connection in the Beverly area. We would love to see you. Come out for anything that we have. We have some upcoming events. We're going to be doing a toy giveaway December the 13th. We'll also be giving away coats for our families. Please come take advantage of it. Yes. You don't have to be a resident of the neighborhood. You don't have to be one of our clients. Just come in and sign up. You can receive toys for the children,
children,
for a
yeah.
girl and a boy.
Maybe
And,
Santa.
and if you want to, you can actually send us some toys, or you can bring them by the agency.
Donate.
Right, you can donate toys, unwrapped new toys. Bring them in, and we'll make sure that they find a good home. So please. Be with us for this holiday season. We hope that everybody had a great Thanksgiving holiday. You had a good Thanksgiving?
Yes, I did.
You have a good
I
Thanksgiving?
did, yes.
So we all had good Thanksgivings, and so we appreciate you coming and listening to us rant and rave about HIV, our new vehicle, and those things that are important to us. Thank you, KNTV.
And once
And we'll see you
again,
next
we
year.
thank the long-time survivors for, following through with their healthy lifestyle, and whoever is in this situation can also get help. Don't forget that this is still World AIDS Month.
Yes,
So,
it is. As a matter of fact, we're
lot
going
of
to
activities
a World
going-
AIDS event tonight at
Yes.
Trinity Hospital. So if you're part of the Deltas, women, please come on, stop by tonight, and you can get an HIV test and some free giveaways, okay? So we'll be there at Trinity Advocate Trinity Hospital on East 95th Street. Please come out and join us. 97th Street?
93rd.
Second.
93rd.
92nd, 93rd, somewhere over on the east side.
It's in between.
But it's Trinity Advocate. We do know that.
Yeah.
Thank you so much. Have a good evening. We'll see you next year.
Thank you.